namaste, and good morning to everyone present. So welcome to yet another featured Qualitist program, where every month we speak to a featured Qualitist. We choose a Qualitist for the month. We introduced this in May of 2021, and though it's been 16 months, this is our 14th Qualitist we are featuring. So by our own standards, we've fallen behind by a couple, but we promised to make that up this month and the next, so that we will be online with the number of months and the number of qualitists that we've interviewed. Now, out of the 14 qualitists that we featured so far, today, the person we are featuring is again from the healthcare industry. So it's our fourth qualitist who's from the healthcare industry. You met, first one was the very first month, after when we spoke to Suresh Lulla sir, he was in the first month when we spoke to him, Anshuman and myself. Then we had Dr. Parag Rindani. Now, healthcare is a physiological kind of a process which deals with the customer himself or herself. And sometimes the end result is visible, sometimes it is not. And yet they have a lot at stake because lives are at stake here. And quality is imperative. And so in our Qualitist, when we have the Qualitech Awards, I remember we had it only as manufacturing and service. And then in service, we started getting a lot of inputs from healthcare, and now it's become a separate category all by. So it's fantastic to see that we have around 30% of our qualitists that we've interviewed have been doctors. So without wasting much time, let me bring in my partner in crime, Anshuman, co-host. The two of us, as Suresh Lulla sir calls us, the quali terrorists, terrorizing the qualitists who come on the show. And Anshuman, so I was just telling the audience, if you heard, that this is our fourth person from healthcare industry, and it just goes to show the impact that they're having on not just our lives, but even the profession, in the quality profession, right? I think we're learning a lot from them. I remember the very first, Qualitist show that we did was with Suresh Lulla sir, right, in the month of May 2021. And if you remember, I've just recovered from a bout of COVID. And I remember it was all thanks to a doctor that I was sitting in front of the camera. Thankfully, that was a mild thing that I had undergone. It was in the Delta wave, actually. So it was good doctors who put their lives on the line and saw to it that we responded well to the entire COVID pandemic. So today, another doctor, right?
Cool. Yeah. Thanks, Balaji. To kickstart the show, and firstly, those who are on the show, let us know where you are from. Looking forward to hearing from you. I can already see the session is live on LinkedIn and YouTube. And if you are not subscribing or following the speakers on the show already, this is the opportunity to do so. It takes a lot to bring these shows to you, and every like and every share and every follow and every subscription that you do encourages us to do more of this, right? The show is nothing without the followers and the fans that we have. So one request as we start the session itself is to encourage us to bring more such sessions. And that reminds me, while we get into the show, the next Qualitist episode or show episode is on 24th. So there will be two in this month, as Balaji pointed out, to make up for one rescheduling that we had. So that we will announce later. But with that, let me bring in the guiding light to the whole series, Mr. Lulla, to the show. Sir, good morning, and over to you to introduce since you are in the show, we thought it will be best position for you to introduce the guest, and since you have worked with her earlier as well, and know her better. Over to you, sir.
Thank you, Anshuman. Thank you, Balaji. And welcome, Dr. Shweta Prabhakar. It's an honor to have doctors participate in this show. And I can only say that I am vicariously fulfilling my desire I was planning as a kid to be a doctor. And then this entrance exam to IIT came up, and I went with the herd to sit for it, and my career path changed. So, as a consolation, I married a doctor. And I have the deepest respect for the medical profession. So I made up this little story. God was the ultimate qualitist. Everything he created is in a state of self-control, and it works in rhythm with all other creations. The human body is made up of systems, right? Several systems: circulatory, respiratory, digestive, etc., etc. And they work in harmony. Each system is then made up of processes. And the processes need to be treated by specialists in the system. Finally, you have problems. And you go to the doctor, the specialist, whoever, and they like to know the symptomatic evidence of your problem with the hope of finding the root cause. Take, for example, you have a headache. What do? You pop a Crocin or something similar. Headache gone. Few hours later, headache repeats. You take another Crocin, and the cycle continues till you say, hang on, this is not a common headache. I must see the doctor. The doctor speaks to you about the problem and then prescribes various tests to be done. Come back with the reports and we will find a remedy. This is what we call diagnostic journey in our quality problem solving. What does the doctor discover? You have constipation. The constipation is causing the headache. So what should you be treating? The headache or constipation? So the doctor asks, what kind of diet do you have, young man? And you say, I like steak, I like fish, I like chicken. Hang on, do you eat any vegetables? No, I hate vegetables. So now the prescription is for remedial action that you start learning to eat green leafy vegetables. I won't. The wife is brought in to disguise the dish and make it palatable for your husband. And so the remedial action happens, and finally, there is relief on the headache. The next visit you go, the doctor asks, how do you feel? Oh, nothing. You're on the defensive. You know it's worked, but you don't want to admit it. And the wife says, shut up. You're feeling much better, and the tension on me is much lesser. Everyone gains. Now, I say this because our problem-solving methodology, from symptom through a diagnosis to the root cause, resistance to change, remedial action. I believe God is the ultimate qualitist. He designed us so perfectly, perfectly. And we have damaged it. And today we see all this climate issues coming up because we have we think we are God. So with that, I hand it over to Dr. Shweta to introduce herself and help me on my passion to interact with healthcare professionals.
Thank you, sir, for setting the context, and thank you very much. This is really an honor to be here. Thank you, Anshuman. Thank you, Balaji. Thank you, Lula, sir, and Qimpro Foundation for giving me this opportunity to be here with you. To start with, I would, say that my Qualitist soul is actually soaked in, two major concepts, which one of them, your favorite and my favorite too, is the Juron's trilogy. And the another one is evidence Donabedin gave, that Donabedin model. So it is a linear framework, very beautiful framework of structure, process, and outcome. And that has really the starting point for my any interventions or any activities or any practice that's really sets the context. And following the Juran trilogy of planning everything and beautifully managing the quality systems is all about, it's vast. It is something like a sea. You just keep on going and evolving yourself, and there is so much to learn. So these are the two basic models which I practice, and I believe in very very deeply into these two models. And with this concept, I have built my quality journey, and currently I'm heading quality and patient safety as well as academics at Fortis Hospital Mohali. And also I'm the CAHO zonal chairperson for North Zone, and CAHO Student Research Mentoring Program Chair. And the rest we will follow in the session. So, over to you. Thank you very much for this opportunity.
Thank you, Doctor. Thank you very much. Balaji, each episode that we do like this, it seems like we are the least deserving to be. I think we had some
I know.
early mover advantage. We got in. If we had to appear for an exam, Lula would have rejected our applications straight away. So we did
Totally.
well by not applying. So well done, man. Uh, would you like to start the questions, Balaji, today?
Yep, yep.
Sure.
Right. So yeah, Dr. Shweta, I mean, when I went through, all of your the details of your career, uh, I mean, now of course you're a distinguished politist. A couple of things to begin with. This is not where you started, right? So could you tell us how and where you began, and more importantly, actually, if you can end it by saying or you answer, how did you meet Suresh Lulla, sir? Because all of us have our own, stories about how we came to know of him. So one is, of course, how you started and how you got into quality, and then how you met Suresh.
Okay, thank you, Balaji, for wonderful question which you have raised. That I have to end up by saying how did I meet. So I definitely do justice, and I will share those moments where I met Sir, and it was an enlightenment for me. As I said, my soul is driven by passion for the process. And that's how I over the years, it's been 2 decades into healthcare. And so that's how my journey, when I graduated from medical school, and I moved into I you know entered into the healthcare industry. I worked as a clinician in various government and private setups. And uh, and uh, if you say, I've been fortunate enough to move around the country, across the country, with my better half being a serving officer and defense service officer. So with this, I got that opportunity to see various systems and in place, and so I've even worked at various locations where even we can't even think of, and understanding the challenges and deep diving into it and setting delivering healthcare is it's quite challenging at times. So understanding and those early initial years were very very enriching and learning for me, and the ethos of the service industry you would abide by, the so that's really has given me the foundation stone, and I owe to my better half, and that's really what I am. It's most of it is being groomed by how we live in this industry and together. So sort of moving out from there, I've once he was posted in the city, capital city, and there I got the opportunity to pursue my post graduation, and that was the DNB in health and hospital administration. And to everyone's knowledge, there's these DNBs are not very common. So generally we have the diplomat of national board is in the clinical fields. So this is in health and hospital administration. There were only few centers, just handful of 2 3 of them, and I got the opportunity to pursue my DNB from the India's premier institute, that is a Ram Manohar Lohia Hospital, Delhi. And those 3 years were really enriching, and learning the systems, the government systems and the public health system. And after that, as we know that the knowledge change your perception, it brings a change in you, and that had really given me a different thought process, how to deliver the quality in healthcare, right? So that was the kind of the seed was sown by the opportunity to do my complete my DLB. And then there were various opportunities which came in. I headed a clinical administration and an accreditation coordinator. We know in the current scenario, the country has, we have our own national accreditation body. NABH is there in the country, and it is very successfully being implemented across the hospitals. So everyone wants to, they are pursuing quality with that intent to get into the the quality and the patient safety culture. So that was an exposure. Along with this, I have that academic bug in me. So when I was doing performing this role, I also got that opportunity to introduce an academic course at an management institute in one of the districts in Maharashtra. So that was kind of also a very kind of an entrepreneurship. So it is a feeling which I had, that to establishing from the novo various systems. So I think so that's one thing which I really am very fond of, and love to do that. So that's which with that I later on joined Fortis Healthcare, and it's been now more than 7 years with Fortis Healthcare, and getting into the medical affairs, and then moving on to, I was para dropped in quality. So it was it was not, it was like you can say it's basically luck by chance, or it's or hungry and foolish. So these are some of the aspects which I would combine. And so para dropped in quality and international accreditation was to start with, and then the journey continues, and I'm currently in the healthcare. Uh, uh, Basically, it's an international organization, and where I'm currently working. I'm really proud to be working with the organization. Along with this, academic passion grows, and sharing knowledge through Kaho, and also I'm fortunate enough to be part of Qimpro, so as Qualitist. So these are kind of the achievements or the milestones which in this journey I have tread, and this journey continues. So I hope I have been able to, take you
We are
through
not
in a.
letting you. We are not letting you go without telling us how
Yeah,
you met.
yeah. How
Yes,
did you meet, sir?
so it's been so I really admire sir, and I've been been reading about quality fables and about attending his sessions and also reading his books on quality. I it's like when that Shah Rukh Khan movie which you say that you intend to meet this person. So I was in my own thought process that I need to meet sir at some given point of time. And then last year the Kahokon happened, and I was there, and there sir was, and we were actually part of that Qualtech Awards, the Qimpro Foundation, which has with along with Kaho we have hosted together, and there we met sir, and there were again the journey continues, the association continues, and so that's how I met sir at Kahokon last year.
Wow.
Thank you.
Cool. So, good start, Doctor. What we will do is that we, of course, have a small set of questions that Balaji and I have prepared. But
Okay.
this is also a shout out to the audience on both LinkedIn and YouTube to put in their questions. Some have already come. Dr. Rajesh is usually the first one to ask a question. Again, he's first one to ask a question. So we will come to your questions in a bit. The audience first. I will blatantly take advantage of being the host of the session and ask the questions we have prepared. So my question, Dr. Shweta, of course, is that you are now a leading qualitist in the healthcare field, and we just got a glimpse of your journey and very accomplished one. And you are also quite involved in Kaho, which is the premier healthcare kind of organizational body, healthcare quality or administration body. We we also know that quality and healthcare are deeply connected, and Mr. Lulla in his opening session also kind of weave that in. That these are deeply connected. There are many other fields where we can manage without quality or with manage with poorer quality than expected, but healthcare is one area where the price of poor quality is extremely high, and it could even be somebody's life. So the without making it too grim, these two fields are of course deeply connected. Can you share with us some examples to illustrate this deep connection and any suggestions to improve quality of healthcare? Firstly, some examples, and then any suggestions that you can share with us. Over to you.
Thank you, Anshman. It's a very pertinent point or the aspect which you have said, that quality in healthcare, right? So it is quality in the current scenario. Earlier it was not, but now it's globally, and even in the small setups, if you see. The quality is now like embedded in the healthcare systems, right? So the basic principles, no matter what, when we talk about even our patients and the customers, the both internal and external customers are more aware about quality, and also the internal customer are also very conscious about the delivering the right quality and with respect to patient safety, because healthcare, it's you have a lot of along with the patient, patient getting treated, but there are also medical legal issues, so we need to take care of both the aspects, from the compliances as well as the patient care. Now, I would give you an example. How did when I started with my first project, and that was a very interesting one, and it was a multi-speciality hospital, and it was in one of the largest districts of Maharashtra, and I again the opportunity came in where my husband was posted, and so it was the systems over there were very very novice, like they were trying to get into the quality healthcare, and seeing that the passion with the clinicians and the teams which were there, they were not getting the way forward, how to go about it, how. So that's why I got the opportunity to be part of that team, and establishing from the scratch, that was a challenging time. So when I say that from the start, so all the systems, because hospital is a diverse organization. You have clinicians, you have got doctors, you've got nursing, you have got patients coming in, but you also have the support system, right? So there is a lot of background supports which goes into delivering the healthcare, and understanding that aspect is also very important. And no matter, if you just name few, is like your pharmacy services, your supply chain, your housekeeping, your HR, finance department, and all these needs to be also evolved, and follow a quality system to deliver patient care in an effective manner. And so it was again a very fortunate times that we I would able to gather and place all the systems in place, and make them go through a quality system implementation, and that led to kind of outcome was that they were able to was a first a hospital in that particular city to get accredited by the NABH. And starting, so understanding the quality also from the top management commitment, as well as establishing the systems from the uh, in toto is that helped. So that was the journey which I started, and there was a lot of learning also in that, because uh, what I feel, so and I would quote many a times, is that every healthcare organization is different. It's not the same. It's everything is not on the same platter. So there is a scope is different. So you need to customize your quality systems as per the need of the organization and the patients who are coming in. So that's that should be be the basic where you start from. And and if we compare with the quality systems in healthcare in the international or a private setup, or where the systems have already been established, it's somewhere, if you can just, I can give an example like my current organization, right, where in the current scenario, the systems are already in place, but you need to sustain them, the sustaining quality on each day, because you need to create this as a culture, as a habit, not like one time establishing a system. So moving from with no systems to developing a system and sustaining them is all about what I think is quality in healthcare, which is what is required. And each person who is being part of the team should understand what are the quality systems are there, and need to be customized according to the need of the organization, according to the need of the customers which are coming and availing the service. So that's my quality in healthcare.
Thanks a lot, Doctor. As you were speaking, I did realize that healthcare, not to make a comparison, but quality in healthcare is similar to quality in banking or other, I would say, highly regulated setups, because you don't want extra creativity and innovation on a daily basis in these sectors. You want more consistency and making sure that the methods are followed. While everybody wants creativity and innovation in all the fields, there are some fields where you would rather have 3 months, 6 months of consistent practice than keep changing methods and practices. So this is a lesson got reinforced as we were speaking, that maintenance of these quality practices is far more important, because in many places the practices are already in place, like your current organization, Fortis, and several other leading hospitals, especially the part of the NABH aggregated boards. They already have the practices, but it is the maintenance of the practice that sometimes and mostly is the key thing, and that is similar to some organizations or some sectors like banking also, because like I keep telling everybody that you don't want to be extra creative in banking. I want, when the customer is putting the card in the ATM, to get exactly the amount that they are wanting in the exact process that they has been subscribed. or shared, not some creative process, or okay, you get the money first and then put the pin later on. That should not happen. So just drawing some parallel. But thank you very much. Over to you, Balaji, for your next question.
Yeah, this was interesting when you use the word customize, and though we have quality systems in place and the customer walks in, every patient is different, and so we need to keep adapting and adopting. So that's what the theme of this next question basically is. All of us in the field of quality, we love to learn from each other, and we find, over the years, the traditional tools that have been used, the techniques that have been used. Some of them have been kind of used as is, and some have been, adapted and adopted in particular domains, right? So we, of course, in manufacturing have done this, maybe in the different industrial type of industries. But in healthcare, has there been any, what has been your experience with the techniques, the tools and techniques? What kind of adaptation did you get in? Because although Anshuman just said the creativity is not so much in, the innovation, but it's in adaptation, I believe, in how you take the principles and adapt and adopt. So anything you'd like to share with us on that front, where you really use something very, very differently and saw something amazing happen?
Yeah, so Balaji, it's a wonderful question, right? And I think so. It's gonna be great sharing gonna happen here. There is. Yeah, I would add on to the customization. It is important because there is dynamic. The healthcare is dynamic, right? Evolving. Like we saw, a wonderful example which we all saw in this decade is the pandemic which hit us, and the COVID pandemic had actually challenged our own settings, our own quality systems which we had placed. Whatever the learnings which we had over the years which we have implemented, whether it's infection control or related to how we want to handle treat the patients, everything was challenged because this was something new which has hit us. And I would say that creativity does happen. We have to be creative, but with certain limitations which we have to be creative. There are certain standards in the clinical settings also. We cannot overrule that when we talk about creativity. Uh, Whether it's like COVID, I would say that when there was a lockdown, I would like to share, some of the things which we innovated in-house. And I would take that privilege that when the COVID pandemic started, the lockdown started, and the supplies were, shut. There was, you were not able to get through some of the supplies and how to get those face shields. So I and my team had actually made those shields from those plastic covers, and initial phase when we had to see those patients like so that was the times when where we started, created, and applied. uh, and moreover, our engineering teams, they were also part of the healthcare system. They innovated how they built a system in house within the lockdown. There was nothing was available, and they built the sample collection because it has to be negative pressure. It has to be some modifications which need to be done. So the sample collection booth was created in house. So these so what I'm trying to take you there is, you again see whatever is the current scenario, the challenges, and try. You must have developed that capacity with respect to knowledge and the skill to at least address that challenges with respect to the within the domain of the quality and the clinical settings. That is one thing which I would share. And then uh, also I believe, firm believe that uh, we need to train, we need to reinforce the skill upgradation of the every healthcare worker who's working within the, if I'm talking about from the healthcare industry, right? So if we need to have a established system, and we need to train, and there is no substitute of training and skill upgradation. So we need to give them the opportunity to enhance their skill. As qualitists, as quality leaders, we need to give them the path, show them the path, that this is how we can bring in the better systems. Technology has really come into play, and adopting technology is the need of the hour. Every organization should take those steps in adopting innovations and technology into their uh, you know small things, because that ease out your work, that work on you can work efficiently, cut down your time. So the time wastage is not there, and duplication of work is omitted. So that is, again, I'm taking you to the reducing the cost of poor quality. So that so you need to identify those pockets, and again, understanding and studying those systems in piecemeals in every department. Where is the cost of poor quality in this department, or is in this area where I need to reduce? Work on the lean management, lean concepts. These are some of the tools which in and out, day and out, we use it and try to brainstorm around it, and evolve in quality in the healthcare.
Wow. Yeah. I mean, to come up with those ideas and solutions, different kind of an application, like I said, of what we call as creativity and innovation. So that's amazing to see what you're doing. I think you could write a memoir, I think, of those times. It'll make interesting reading for every one of us, because all of us were at home. We had our own silly problems. We thought we had problems. We forgot that the healthcare workers have bigger problems, and had to deal with
I
something that
just
was.
to add, Balaji, everybody in lockdown enjoyed work from home or the lockdowns, but we never did. I had no, even I didn't had, I was quarantined people, but I never had to be that privilege of quarantine
Quarantine.
myself.
Yeah,
So
your WFH was work from the hospital. You said no.
yes, yes, and to again, if I can just get one point to add on here, is one of the another very my favorite tool is doing a proactive risk analysis. So that has actually uh, this pandemic phase has given us the opportunity to actually shift our thinking towards proactive risk analysis, and identifying the possible risk which can occur, and that can have an effect on how to mitigate them. So we have a plan
Right.
ready. When we conduct the proactive risk analysis, we already have a plan ready. So we don't have to rush and create something which is already have, just implement it when something happens. So thank you.
Wow. Yes, Anshuman. Anshuman, we can't hear you.
Last time you told me you are
Yeah.
better off hearing you, but I tried
Oh, really? No, no,
that.
no.
Dr. Parag has sent a message to us, sir, which
He says healthcare quality in India would have been much better if Mr. Lula had become a doctor.
I
No, we
think
wouldn't have met him. Dr.
yeah.
Parag, we wouldn't have met him.
So there are quite a few messages. I'm just looking for a quick question. Dr. Shweta, there is a question from Dr. Rajesh, uh, and I guess his question is more about, do you use process mapping in healthcare? And if yes, then how do you use? Very quickly, if you can answer. There are quite a few questions, so I'll try and take as many as I can.
So absolutely, this process mapping is again one of the it's important in our healthcare also. We do process mapping where we need to re-engineer our process, and there are some gaps which are frequently occurring, and we need to obviously we need to understand, and that's a basic. So process mapping is important, uh, right from the patient entering into the system, the patient is entering, what are the checkpoints, where all so can I add in here is, Dr. Rajesh, we have in healthcare, patient safety is the paramount importance, and uh, we have implemented patient safety goals. So these are some of the patient safety goals which are globally recognized, international patient safety goals, and in that every goal, like right from the right patient identification. So you need to have to ensure the patient need to be identified correctly, because if we don't identify correctly and if we don't standardize this process, we there might be various errors can happen. So whether the patient is coming for admission, whether the patient is getting any for investigated for any sample collection, whether the patient is being administered or transfused blood, these are or the procedures, the patient is going for a procedure. So the safety checks or safety pause is very important, and in that whole process is involved. So we need to do a process mapping for each and every step to ensure patient safety. That is,
Yeah, it totally
thank you.
makes sense. I think that was probably the intent of his question, coming from the medical profession himself. Um, I might be butchering this name, but INR
Shanmugam.
Shanmugam. Shanmugam
Shanmugam.
has a question. Yeah. So my apologies, first of all, for butchering your name. But many healthcare organizations think complacent or become complacent once the accreditation is achieved. I'm assuming references to NABH. And this is not just for healthcare. This can be for any type of accreditation
Exactly,
certification
yes.
in any industry. How to sustain the same? Please suggest a few quality improvement projects which are needed. If not projects, at least what did you do in your experience to make sure that you were able to sustain the levels achieved?
So, very, very valid point here. He is trying to raise that, once being an NABH assessor, we do find in when we go for reassessments and all. So, this is one thing which is once accreditation is achieved, we've got that letter and that certificate, we take a back seat, and the quality takes a back seat. That should not. How should we approach? Now, being the quality leader in your organization and an accreditation coordinator, your role doesn't stop just by achieving accreditation. It should continue, and you should plan. Annual plan has to be drawn. Formulate your internal audits frequently. Quarterly internal audits should be conducted so that you ensure that whatever has been achieved should be sustained. So this is you need to make the team understand that there are quality systems. It's a journey where we talk about. It is not a destination, so it is just a team. So it has to be driven by the top management as well as the team who are leading it. So just keep on monitoring. That's the intent. Make a calendar of internal audits and just keep on monitoring and review. Have committees which should not be on papers. It should be effective committees should be there to review the systems, and that's all. That's a way forward.
No, I think well said, Doctor. There have been similar questions in our other shows as well. Sometimes with a different context, but each time, I think an accomplished person tries to answer this, Doctor Shweta. I have seen a theme. The theme is that motivation is overrated. So it is not our motivation that will drive us through. It will be the system, the process that we will put in place.
Absolutely.
So, in most cases, the will and desire to keep excelling is not adequate enough because there are so many interconnections, other departments, people, everybody has to be taken together. So it is eventually like Dr. Atul Gawande, who's major
Correctly.
person in the healthcare quality field, in general in healthcare as well. He also says that simple tools like checklists also can be amazing in healthcare. So, uh, and you've in
So
a way reinforced that the it's not just motivation that I want to do well. What is the system, what is the process that we have put in place to make sure that the same things are being done over and over again. There are simple things like washing your hands, making a checklist, asking the patient with this your right leg that we has to be operated, and so on. I'm just kind of explaining it further. So hope Einar, you had your response. We'll take one, or maybe we can move to the next one actually, which is from our list, which is around. So now, of course, as an accomplished professional in the field, doctor, you've had a long journey, and but if you were to advise yourself, at the start of your career in the quality profession field or healthcare field, what would you tell the young Dr. Shweta who would be getting into this field? Or if somebody comes to you for guidance at the beginning of their career today, what would be your guidance to such people? Anything for the younger lot in our show?
I think so. Anshuman, it's a. I've been really fortunate enough to have people, good people around me, where they have given me a very good environment, and they have supported my passion. So that's your inner self. One is that the soul, your soul should be passionate about what you're doing. I love my work, and whatever I do it with full zeal and commitment. So that is one thing which has not changed in me, and I would not only advise is that whatever we should do it with full commitment and the passion, because if we do something very half-heartedly, we don't achieve what we intend to achieve. So that is one thing. No matter what, whether it's household activities, whether it's academics, whether it's quality, or whether it's your own profession, whichever profession, this concept or this principle has proven always right. So then only we can excel what we want to do. But yes, for the what is now, actually the culture has started. So bringing in quality into the younger minds, at least introducing this concept, because earlier it was not known. Only what is quality, uh, you know uh, people don't know much about it. The young medical students, they don't know. So that it has to be started from their medical curriculum. It has to be started that at least some talking point about patient safety. So we don't talk about patient safety, we don't talk about quality in medical education. So that has to be started. I would advise that this should be taken up as a part of a curriculum also. uh, you know they need to be passionate about it. That is all, the commitment, which is sometimes these the not these, but the younger generation is, they want quick fixes. They don't wait for something. So need to be patient. Quality is all about patience. You have to sometimes we apply quality tools, or we conduct quality improvement projects wherein we don't achieve anything in one PDSA cycle. We have to go back to the drawing board, and then again think about what went wrong, why we are not getting the outcome better. So you need to be patient about any change which we want to achieve, or any quality systems which we need. So keep on improving your own thing, be patient about it, learn. There is no substitute of knowledge, so one has to keep on learning, keep on enriching themselves. So that is one thing. And the young Shweta was, I think so, has been fortunate enough, and that's why I'm here with you all, the eminence qualities, and Mullah sir. So, the God
No,
has got.
the young Shweta has done well. So I agree that one more question, and Dr. Parag wants to know, how do you quantify financial savings in your quality improvement project? So, um, of course, like everybody knows, if you are NABH accredited hospital, or any hospital or any organization which is on the path of quality improvement, one of the best practices is to quantify your financial savings. So, the question, therefore, is a little bit on how do you do this? Therefore,
Very, very valid. Thank you, Dr. Parag, for being there, and I really appreciate. This is now the current need of the hour, and various effective cost-saving projects have been implemented, and I've been very fortunate enough to be part of it. One is the area which to focus on is the energy saving. So in healthcare, we use a lot of energies, lot of a lot of engineering systems, and so whether it's electricity, it is water, and what waste we generate. So a lot of savings, financial savings, can be attributed once we understand that how we efficiently run these systems. And quality improvement projects in this sustainability projects can be efficiently being implemented here in these. And the other one, which what we did was, I can share my examples from my organization, is at least two of them. So we are working on, there are every accreditation, it adds on to the documentation. So it over the years, and it's been like more than a decade. So there is so much of documentation keep on adding, and there's a duplication of work which happens, the duplication of documentation. So we are trying to work on the lean concept and trying to reduce the documentation and see where it can be integrated, and uh, they can be reduced, and that is saving us on a lot of not only the cost of the stationary cost or printing cost, but also the effective hours of the healthcare workers to be available for the patient care. So we have saved so much of time of the nurses in reducing the documentation. Effective documentation is important. So what we want to achieve from documentation is to be aptly documented, and it should not be duplicated like a 2-3 healthcare workers documenting the same thing. That doesn't make sense at all. Reducing that so that the nurse care, the time the nursing care is effectively available for the patient. So this is one area where it's an ongoing project. We have got some various small achievements here. And the second one is the antimicrobial use. So there is when we use antimicrobials, uh, and we don't justify it, we use it extensively, and that's also adds on to the cost burden to the patient as well as sometimes to the organization. So these are some of the areas which we have some wonderful projects being implemented, and they have also been presented in DL Shah Qualitech Awards, DL Shah Awards. Thank
Sure.
you.
Thank you, Dr. Shweta.
Thank you.
Mr. Lula, you wanted to say something?
Yes, I'm glad Parag is around. I'll just put in another thought. Having a system, getting it audited, essentially, the audit says you do what you say you do. You do what you say you do. That doesn't guarantee quality. There's a chapter in NABH, the last chapter. What is that? Continual
I
improvement.
like
Improvement is like the heart of a patient. If it's not alive, the system is dead. Now, you must have a very systematic method of prioritizing the problems that you are solving, and keep as a goal that if I haven't updated my system every week, there's something wrong in my system. I have a dead patient. So, all I'm trying to emphasize is just having a accreditation and another accreditation and so on doesn't make you quality. It only makes you very administrative, you know, losing a lot of time. Time is the most precious and perishable resource. How we use it will make a difference. So select projects on processes. Your support processes can lead to horrible outcomes in clinical process, purchase, maintenance, etc. Power failure. What happens? Patient dies on the in the surgery. Pay attention to purchase and support services and the processes, and you'll be amazed at how collectively you can customize your actions for the customer, the patient. Over 70% of improvement problems come from non clinical areas. They're imported from purchase, poor maintenance, housekeeping. And there was another comment about culture. How do you create a culture? Focus on housekeeping practices first. Sensitize people to detecting something's wrong and that benefits them when it's cleaner. 2, focus on safety. Safety, not just the patient, but also the employees. Sensitize them to detecting errors. Then your quality system will flow. But without safety and housekeeping, you will always be firefighting something or the other. And I'm sure you know all this, but I thought I would remind you about it. The rule is simple: housekeeping, safety, then quality. That's my comment.
Thank you very much, sir. The show is not complete without such nuggets coming from you. We look forward to that time when these nuggets will come. So thank you very much. Balaji, we are almost towards the end of the show.
Yeah.
There is one mandatory question about books and all that you love.
Yes.
I'll leave it to you.
Yeah, Dr. Shweta, I mean, we're all keen, besides, we've all had some common literature and quality, but anything that inspired you and you'd like to share with the audience, the books that you would recommend for us to read, not just healthcare quality maybe, something that...
So the books are endless, right? So there is no dearth of knowledge everywhere. So it is a lot of books which are there. But I do follow the risk management from Barbara. So that is a wonderful book to which I have read, and it's always I refer to whenever it is there. I do read about various fables, Lasser's fables, which I'm really fond of, and and Dr. Girdhar Gyani is one of my favorites. So his and we have quality again. One more book on quality. It is very beautifully written. Is from Maulik Joshi and one uh, another author, but it's wonderful book to read. Uh, Again, I would say that it is also important being a qualitist is to have your your mind and soul should be aligned. You need to think in a peaceful manner, and uh, and that's like kind of living a zen life. So we need to have that clarity in the mind is important. So that's one thing. So everyone's has their own favorite pastime or the way to get yourself aligned. It's important to back to basics. I whenever you are it's no matter, so many things are written in the books and so many processes. You can go and refer to the standards and the technicalities. But what you achieve on ground, there's no replacement for that. So whenever you're working and you want to, evolve and you want to create, you have to just go and work with the managers, with the baseline managers. There you will get to know, when you will do that process mapping. It was a wonderful question, because I do a lot of process mapping, and I follow that path, just to get onto the solutions. So, and the the problem solving, sir, course is wonderful. The pro from the Qimpro, it's really gives you a, alignment to how to get to the root. So that is, these are some of things. And now the virtual world is full of knowledge. There are so many online courses and online materials are there. So keep reading. That is one thing. We should never stop reading, and keep enriching ourselves. That should be the
Thank you
takeaway.
very much. Thank you very much. We are up on time, but any closing comments from you, Mr. Lula, or Dr. Shweta? Anything in closing before we just call the show an end?
I have
So,
nothing more to add. Thank you.
Fantastic.
Just keep reading the quality fables and you will have demystified quality.
Absolutely.
No accreditation needed, no sigmas needed, just your common sense.
So those,
absolutely.
those, those of you who are new to the show and are wondering what quality fables are, these are a series of 4 books written by Mr. Lula, which include many years of his experience and beautifully weaved stories into quality concepts, and sometimes the other way, quality concepts into stories. Um, Available on Amazon, and if you need any help getting them, let us know. So with that, we'll call an end to the show. Dr. Shweta, thank you very much. Mr. Lula, thank you again for joining the show. I'm Balaji and I are certainly enjoying these shows with your presence as well. So thank you. And like always, we end the show with announcement of the next coming up shows. So I will take the liberty of also announcing another show in between, which is next Sunday with Bharat Waklu. Bharat Waklu will be on my regular show, which is the Manage Better show on Sunday, not Saturday, 11 a.m. But the Quality show will be back on 24th, which is a Saturday, with Neetal Zaveri, another featured qualitist for the current month. So don't miss out the shows. We will, of course, announce the shows online, and looking forward to seeing you there. With that, it's a wrap. Thank you very much, everyone, those who joined, and also please spread the word. Thanks a lot. Bye bye.
Thank you.
Bye
Thank you
bye.
very much. Thank you. Thank you,
Thank
sir.
you.
Thank
Thank
you,
you.
Anshul. Bye-bye.